Last time we spoke a few weeks ago, I know you were comfortable with the decision to keep them closed. Now that the number of new cases seems to have dropped quite dramatically in most places, is there actually a need on the medical front to keep those borders closed, in your view?
Well, we are doing well from a coronavirus perspective, and that is nice to acknowledge. I think we've got to recognise that there's no rule book here, and the pathway to success is probably going to look a little bit different in states and territories. I remain comfortable, and the AMA remains comfortable with the states and territories taking the approach that they feel best. We're clearly all pulling in the same direction and moving towards that goal, and there are different variables. So, for example, different case numbers in different states and territories. So I don't think from the medical point of view we need to push that at all, and we're quite happy to be informed by the numbers and the medical advice going forward and be very cautious about further lifting of restrictions.
Just how worrying is the news we've heard today that a person who attended the rally on the weekend in Melbourne has now tested positive to COVID-19?
Look, it is worrying, isn't it? And I mean, first of all, to that patient, I hope that they have a benign course and get better quickly. But it exactly goes to the heart of the concerns around collections of people, people gathering together where the opportunity for the virus to spread is increased. And it's that community transmission that we're obviously trying to reduce the case numbers. So we would implore people that no matter what they're doing, whether they're at these events, whether they're at work or in their daily lives, that we adhere to those physical distancing, hand hygiene, etc. measures, because that's what's going to keep us safe. And we must do that because the virus is still out there. So, of course, now the testing, contact tracing and all those things become very important in those cases that we've identified. And we've just got to clamp down as quickly as possible on them.
But Chris, how great a risk is it really turning up to these rallies, especially in places like Perth, for example, or Darwin, where there isn't any evidence of community transmission? Is it any riskier for people in those states to turn up to these protests compared with, say, turning up to Bunnings on the weekend or heading out to a restaurant or sending their kids to school?
It's a fair question. And I think the answer is that so long as we are doing the physical distancing and all those other sorts of things, then we can go about our daily lives as we see fit. These protests that we're referring to, obviously deeply important to a large number of people. From a medical point of view, we acknowledge the disadvantage faced by Aboriginal and Torres Strait Islanders and other subgroups within the population as well. And so they're deeply personal and appropriate issues, and it's nice to see people caring about each other and actually having a voice on those things. But it doesn't mean that we have to relax restrictions. We can still be careful. We can still do all the sensible things to reduce virus transmission in everything that we do. And I think that's the message. And we just have to look now, for example, this case that's come to light in Melbourne, and we've got to hope that there isn't wider spread as a result of that. So we'll get onto the contact tracing and fingers crossed that we're going to keep that well contained.
The person who now has coronavirus from Melbourne, from that rally there, the advice is that they may have been infectious at that point when they were at the rally, but they were wearing a mask. How much risk is actually mitigated by wearing a mask in that scenario for people who are thinking about turning out at these protests?
A reasonable amount of mitigation does occur. I think it's important to make the point that if you're completely well, then wearing a mask is not required, and we're comfortable with that ongoing advice from the Commonwealth. If you've got symptoms, then of course that's a different matter, and clearly you shouldn't be going to any rallies or work or anything if you've got symptoms of a respiratory illness. If someone felt more comfortable wearing a mask, of course they can do that. If you've got chronic medical problems and that's your choice, then by all means. Does the whole population need to wear masks to protect themselves at these things? No.